It's the old adage, the customer is always right. Is that true in plastic surgery when a patient comes in and has some ridiculous request?
So I like to think we don't use the words ridiculous requests.
Well, we're just talking amongst ourselves here.
But I think that, yes, the patient and customer is always right in wanting to talk about something, but they don't know always what they should or can have. And I think saying no is one of the hardest things that we have to say to a patient, or that we need to say to a patient, but I think we need to, sometimes.
I think it's okay to say no, but I would also check with the patient and see what it is that brought them in, and why are they talking about this, and why do they think they want it, and then try to say, well, what you're asking for is this, and this is for these problems. Your situation is maybe different and not that. So maybe they're coming in because something just bothers them and they think that lip filler is the solution, when actually maybe it's not. Maybe it's Botox, maybe it's some other procedure. And so try to get them on the right path.
I completely agree, and I think that a scenario where I'm usually saying no to people is when they're asking for something minimal, but they're really looking to have a significant response. So say for a facial procedure, they keep doing this.
Right.
And they think that a syringe of filler will achieve that. And I think it's up to us to educate them that they're actually looking for a surgical result from a facial procedure as opposed to a non-surgical injectable
Or in
procedure.
simpler terms, they're looking for a lot more result.
Correct.
From something that's a little result.
Correct.
So it's like, well, okay, that's fine, but you could have, $5,000 worth of fillers and you're not going to get where you're at, even though your friend had filler.
Right.
So let's talk about fixing what's bothering you, or correcting, or getting rid of the concern that you have.
Right.
And it could be surgery, might not.
Agreed. And another example, I think, is breast procedures, where a patient would like to have breast implants because their friend had breast implants and that's what they want to rejuvenate their breasts, but they have sagging breasts that we know is tonic because they've had multiple children, or weight gain or weight loss, and they need to have actually a pretty significant surgical procedure where lifting and mastopexy augmentation, and it's just a completely different animal that they're talking about, and we have to talk to them about that because someone else will probably do something for them. And
they'll always find someone
Correct.
probably to do what they want. But the best thing is to hold your ground. And I think if you hold your ground and you do that, sometimes they come back 5 to 8 years later because they maybe didn't go with your advice. They did something else, and now they're back because they know they should have listened.
Correct.
And nobody's perfect all the time, nobody's correct all the time, but try to be.
Right. And we're in aesthetics, but we're physicians, so we have to take care of our patients.
If you'd like more information, go to theplasticsurgerychannel.com.